Now, last but not the least comes the classification according to the shape. If you go as per the shape, we have long bones, short bones, flat bones, sesamoid bones, and we have irregular bones, pneumatic bones, and accessory bones. All right. So, as per the shape, we have accessory, pneumatic, irregular, sesamoid, flat bones, short bones, and long bones. I'd go with the example of each. What comes as accessory bones, or also known as the supernumerary bones, means these are the sutural or the vermian bones. We have cervical ribs or the lumbar ribs, and these are usually bilateral cervical ribs and lumbar ribs. That is extra bones in the ribs, and sutural or the vermian bones that happens in the skull. So these are the examples of accessory or the supernumerary bones. What about the pneumatic bones? Now, pneumatic bones are ones those having the air sinuses like the maxillary sinus, sphenoidal sinus, ethmoidal sinuses. We also have frontal here. So these would be the pneumatic bones which have the air sinuses in them. A very good example of irregular bones are the hip bones, the sphenoid bones, the C1 and the C2, the first and the second cervical vertebrae, that is the atlas and the axis. All right. Sesamoid bone, it is very, very important. Short note always asked during your vivas and in theory. You have to name the features, the importance of sesamoid bone, give examples in which muscle they are formed or the tendons of which muscle they form and where they are found. So this is a very good revision for you. What is sesamoid bone? We have 1, 2, 3, 4 major sesamoid bones in the body: patella, pisiform, flabella, and the rider's bone. Found in which muscle? Quadriceps femoris, pisiform in flexor carpi ulnaris, flabella and the lateral head of gastrocnemius, that's in the lower limb. This is in the upper limb, lower limb. Rider's bone found in the adductor longus muscle. Flat bones. Flat bones are the sternum, ribs, scapula, and the vault of the skull. Short bones are the cuboid, scaphoid, carpals, and the tarsals. And the last one, that is the long bones. We have the typical long bone, a miniature long bone, and modified long bones. So what is a typical long bone? It has two epiphyses: humerus, radius, ulna, femur, tibia, fibula. Miniature long bone means these are the short bones, but they have only one primary epiphysis, that is the metacarpals and the phalanges. What is a modified long bone? It has no medullary cavity. The clavicle. Clavicle also has other peculiar features which you'll learn during your class. So that's it for now. We have the classification of bones according to the shape: long bones, short bones, flat bones, sesamoid bones, irregular bones, pneumatic bones, and accessory bones.